So I'm delighted to announce that coming up next, we have Lillian Maas and Wim Breeman from Rotterdam University of Applied Sciences in the Netherlands, who are going to speak to us about an international perspective of education issues in advanced practice.
Hello. Good morning, everybody, to our friends in the UK. I'm Lillian Maas. Clearly, I'm not Dutch, but I got here as quick as I can from Texas. So I speak Dutch with a Texas twang, and I've been working at Rotterdam University for the last almost 20 years. I'm the international coordinator for the nurse practitioner program, and I am presenting today with my colleague Wim Breeman, and you see both of our pictures to the right. I am the international coordinator, so I'm there with my on an international trip drinking Aperol Spritz, and my colleague Wim Breeman is the emergency care professional, and he has a love for his helicopters. Oh, that got quick. Okay, so Rotterdam University is based in the city of Rotterdam, which is a port city in the Netherlands. So just a little background of it. It is the birthplace of the famous philosopher Erasmus. A lot of these educational programs are called Erasmus. I'm not sure why it's going. Let me go back.
Yeah, because that's a good slide. You have to go one slide back.
Yeah. Okay. Back to here. But the thing about Rotterdam, things were life altering for the people. So back in 1940, it was bombed. It became a very devastated city. It was leveled to the ground in World War II. So it became a very poor worker city, people that worked in the port and, lower socioeconomic at the time. But now, fast forward 75 plus years later, it is a bustling modern city with lots of students, also new immigrants, and we get about 120 cruise ships docked here. So it's changed from the bomb city to a city that found its heart again. Just so you know, it's the only city in the Netherlands that has a modern skyline. Because it was bombed, it was able to build these skylines. We are the home to Erasmus Medical Center, the largest in the Netherlands. We also are home to Erasmus University. Was it doing that? I'm not sure. The biggest port in Europe. So this really defines our city.
And I'll go you have the wrong. Yeah, you have the wrong slide. This is the current slide.
Oh, that's the current slide.
Yeah.
Oh, I'm so sorry. I hope y'all kept up with that.
No problem.
Oh, I need to go to the next slide.
Yes, that's correct.
Correct.
Yes.
Okay. Sorry, guys. This is different technology for us. So, in any, oh, let me go back because I can't, for some reason, I can't see. Hold on. I'm not seeing my image here. There we go. Let me go to the next slide. All right. So just so you know, the nurse practitioner role in the Netherlands was started in 1998 in the town in the north called Groningen. They have been officially registered in the law in 2009. So they get the nurse practitioners here have full prescription authority, full independent practice, strong nurse practitioner organization, and in this year, we will have our 15th NP conference in Rotterdam. So it's quite organized profession. Let me go to the next slide. And our students, just so you know the background, they must have a bachelor's degree in nursing, 2 years of nursing experience, must be employed as a nurse practitioner, and but they are in various specialties. For example, oncology, geriatrics, primary care, cardiology, public health. So our students are essentially a generic program, and they specialize within their own practice. And
okay,
for you, Wim.
Yeah. Thank you, Lillian. Well, just to introduce myself a little bit, I'm Wim Breeman. I'm a nurse practitioner emergency care, in pre-hospital care, worked at the trauma helicopter and the ambulance in the Netherlands, and I've been a teacher since 2009 for this program. As Lillian said, we have full independent practice since 2018. We were officially registered by law in 2009, and so we have completely full independent practice authority. I think that's very nice. 2 years ago, we got a brand new professional competency framework. And I think it's nice to mention that our program is funded by the government. The employers get funding from 2,000 euros a month for a maximum of 24 months. And then the educators or the preceptors get another 250 euros a month, also for 24 months. And we just heard, and we are very happy about that, in the next year we get a total of 722 places for new nurse practitioners education, and that are 138 places extra on top of what we have at this moment. That's a bit a challenge for our university, but we are very happy that the government helped us with this in an aging society where we need more and more nurse practitioners. You have to have a job. You have to apply for a job as an MP student in the Netherlands, and you can only register for the program if you have a job as an MP student. So with that, we are sure that you are not work as a nurse, but you are work as a student MP. I think that's an important issue. You need to have a contract for 32 hours a week, and you spend 1 day, that's 8 hours at university. When we've got that new competency framework, we also got a new model. Of course, we use the CAMETS model, as you all familiar with. But besides that, we have a new we called it a T-shaped model, and we see the MP as a T-shaped professional. It means that they have the in-depth problem-solving skills within their own competency area, and are also able to interact with other professionals from other specialties. And the vertical part of the T, that is built of the specialist skills, in either somatic healthcare or mental healthcare specialty, and within a focus area. And for example, a focus area is primary care, specialist medical care, chronic care, acute care. And the horizontal part of the T, that is that are the generic competencies who are allowing to work together with professionals from other disciplines. So I think that together with the CAMETS model is a good model to show what we are capable of as MPs. In our university, we start using, when there is a new competency model, we had to got a new curriculum. And there we start using the AAPEs. I'm not sure if you're familiar with the term AAPEs, but that are complete units from professional practice. And they are showing essential competencies which trainees must become proficient before they got independent practice. And At the end of year one, it's a 2-year program. At the end of year one, they have a supervising level from 3. And at the end of year 2, the supervising level is 4, so that's almost complete independent. And at this program, we have a global program, and that's where we are very proud of. And I shall get the next slide, and then Lillian will tell you about a bit more about that global program.
So, fortunately, I work at a university that supports international perspectives. And one of the items that I was able to really broaden in the curriculum is internationalization. And I firmly believe that you should look across the borders for other solutions or other inspiration. And so one of the items in our curriculum is that our students have to participate in a 1-week international trip abroad to another country that supports advanced practice. So they visit clinical practices and the university, do presentations, discuss. My students they're Dutch students. So even though the Dutch are good with English, it's not their first language per se. So I have to really help them during this journey to improve their medical English skills. And so that's also something they have to learn, which is not in most curriculums, of course. So, but our students have to present, all of them. So we have 44 a year. All of them have to do a 10-minute, like a med talk, like a TED talk, but a med talk. Wherever they go, they've got 10 minutes, 10 slides, 1 minute a slide. The whole point is, can you make your story succinct and to the point to keep your audience interested? So we believe that's fundamental, just like an elevator pitch, to get ideas going. So this also promotes leadership competency. Probably one of the most scary things for me when I became a nurse educator, was presenting. I think presentation skills are essential, but they're very scary, and maybe one of the hardest things to master. But my students do it, and they do it in a foreign language. So it's very much confidence building. Also, they know the importance of sharing knowledge. What you learn in your home, you should share. If you've done a nice research, share it with others and get the discussion going. But also, we forget, you're ambassadors for this role of advanced practice, advanced healthcare practitioners. And I say to my students, we go to different countries, and I say, don't forget, you may be the only Dutch person they've ever met, and make sure that you leave a good impression. And we're ambassadors for our profession, whether at home or abroad. So I will show you that some of the trips we've gone to. Wim, I just got to keep clicking it.
Yeah, I think so. Yes, right.
Okay. So, well, I'm from Houston, and we've been to Huddersfield, we've been to Minneapolis, Dundee, Swansea. So we have been to our UK friends as well, and it's good to have partners a little closer than Texas, and to learn from each other. And it's been wonderful. And I tell you, the international trip is so impressive for students, and it makes them appreciate their profession even more, because they all know we're in this together collectively. And another thing that is important in our, we have themes also in our curriculum, are 2 themes, I guess you should say. We focus on big city health issues. The world has changed. The populations we live in has changed. So we have to change as professionals as well. So what we're seeing is, of course, refugees, immigrants. We're also starting to recognize and put more emphasis on low literacy. Even if you're born in the Netherlands, not everybody can read. And we need to also be more sensitive to these other ways that people aren't getting care. And it's just because maybe they can't read. Also, that we introduce, how important infectious disease can impact our care, whether it's from COVID. We had scabies has made a big outbreak over here. pollution, there's other issues that we need to discuss, loneliness. So these are, we call them big city health issues. Of course, they can affect any little town, but we want our students to become a little bit more publicly aware with their population who may show up at their door. And of course, the core business is your clinical care. So at school, we do generic topics, a variety of topics. Students will specialize their knowledge at work. They'll go into the depth of the knowledge at work, along with their medical and nurse practitioner preceptors. So they are at work with a doctor and a nurse practitioner who are supporting their education in the practice. Of course, one of the big important things is how to learn to critically think. Health assessment, everybody has to do that. That's fundamental. And of course, research. Our students also have to do a research project. But ultimately, we say you need to develop your role in your practice and show leadership. Because I always say, proud nurses, proud healthcare professionals deliver good care because it's their identity. So, in summary, we welcome you. This is my colleagues, my wonderful colleagues, and we welcome you to visit us. We're going to have every April, we have an international week about April 8th through 11, and we go to different practices with whoever shows up. We also get you to present to us to share your best practice or any research or innovation. So please think about coming to visit us. We're really close to Schiphol Airport, maybe half an hour, so easy to get to. And last but not least, I will say a good teacher always begins as a good student. So let's help each other and teach each other. And I will leave you with this quote from Erasmus, who was also friends with Thomas More. He didn't have such a great outcome, but they were good friends. It shows that it's good to have friends wherever you go. He says, when I get a little money, I buy books. And if anything is left over, I buy food and clothes. So we as teachers, we definitely like to make sure we're up to date with our books. So if you have any questions or any comments, please ask us. Thank you so much for letting us be with y'all today.
Okay, and if you scan the QR code or go to that link, you can find us complete professional competency net framework in English. So then if you want to know more about our competency network framework, then you can find it there. Thanks for having us.
Yeah, thank you.
Thank you so much. You've just made us all so jealous of your programme and the need to have that international visit. So well done for including that within your programme, Lillian. I think that's amazing that you've managed to achieve that, and it's been fantastic hosting you in Dundee. We had such a great time and learned so much from students that attended. So definitely a really good opportunity to share knowledge and experiences and network with individuals from different countries. But I think we're all so jealous now that you get the opportunity. I've just got a few questions for you, if that's okay. So can I ask, is advanced practice limited to nurses in the Netherlands? Are there any plans for multi-professional advanced practice, or does it happen at the moment? Oh, can't hear you, Vim.
Program is limited to nurses. You have to be a nurse to get into the program, but we have a PA education, physician assistant, and that's open for all kinds of specialties.
Okay, thank you. Do you offer specific programs for emergency practitioners or major trauma?
No, not specific, because, and I think I didn't make that clear. In the past, we used to have 5 specialties: acute, chronic, well, so on. But that didn't work. So we ended up now in the new framework with 2 specialties: mental health and general care. And that are the official specialties which we were registered with the government. And we have our specialty program in our workplace. So we have specialty areas, but that are not official specialties. So you can choose whatever you want. And that education for your specialty is taking place at in your work situation.
Yeah.
Okay. Thanks.
And because roughly 80% of our study points are coming from the practical program.
So you
I
have
will
to be employed. On you go, Lillian, sorry.
I just wanted to say that our students, there's an agreement with the practice. So any of our assignments are implemented in the practice. So they agree to the innovation product. They agree that they have time for research. So that's part of the requirements, that our assignments are implemented in the practice.
Okay. And who would support them in practice? Would that be a mixture of the academic and the practice setting, or would it be led by the practice setting?
That's a nurse practitioner. That's the official educator in practice. There's one official educator. That's the nurse practitioner, and there's always a medical doctor who is also present, but that's not the official educator.
Okay. Thank you.
But there's an agreement with the university and the practice, and they both get funding.
Okay. So it's good to hear about the variation, isn't it, across the country, some of the similarities and some of the variations as well. What would you say, what does the future look like for advanced practice in the Netherlands? Are there any specific developments coming?
No, we want more and more, of course. But I just when I logged into the conference about an hour ago, I heard a discussion about how you called it, task substitution. That we need to get rid of those lines. And I think the same discussion is here at the moment. It's not a substitution anymore. It's fully completely independent profession. Yeah,
absolutely.
Well,
that's so important.
But I will say what I'm seeing as far as trends, we're getting more students that are in oncology, the need for oncology care, the need for, elderly care, that's not new, but also the need for more primary care. So I've seen a change in the need. It used to be more hospital-based, but it's kind of going out more, I think more to, nursing homes and healthcare centers.
Yeah, and the pre-hospital care also. When we look at the ambulance service, we have now a substantial amount of MPs working at the ambulance service, who are treating the patients at home. Don't take them to the hospital because there are long waiting lists on the ER, and so they have the advanced equipment like ultrasonic diagnostic possibilities. So they can leave the patients at home earlier, and I think that's changing at the moment.
Yeah, that's good development. Yeah. So, what advice would you give to a nation who's not as far along the advanced practice continuum as you? Where would they start?
Get your nurse leaders out there. Anybody who is willing to break some barriers, and sometimes it's lonely, but your passion has to be greater than the criticism. That's what I would say. Show your leadership, and there's a saying, even if your voice shakes, don't lose it. So fight for the role you believe in.
Yeah, strong leadership, so important. So, can you just answer, do students self-fund the international trip, or is it incorporated into the programme fees funded by the university?
It's incorporated in the funding.
Yeah.
We asked, every university gets a bucket of money per student, and we said we will only take this money, but we will take the money, but part of that money is going to be for the trip, which is about what, 2,200 euros.
Yeah.
And we say, we won't educate them if you don't agree to give the money out of that bucket to us for that trip. But actually, there's never been a practice that said, no, you can't do that.
Yeah, that's good.
So other universities get the same amount, but if they don't go abroad, they keep that money.
Yeah, the money officially is for replacing the nurses if the nurse want to start an MP training. The organization get money to replace the student with a fully trained nurse. But they also have to pay the books, all kinds of things who are needed for the program. And the international trip is one of them.
Yeah, that's something for us to consider, I think, in the UK as well. It seems to have raised a lot of interest in the discussions. So, question here about how do you monitor qualified nurse practitioners to ensure they're practicing at the right level post-qualification?
The post-qualification, we have an extensive program by the nursing board. We have a special section of the nursing board for advanced practice. And they have to do some, they have to get some credits, CE credits, 200 points in 5 years. They have to re-register for 5 years. They have to work for a minimum for 3 days in a week during those 5 years. And they also have to do some, we call it, how you call it, Lillian, intercollegiale toetsing, intercollegial toetsing?
Yeah,
Interprofessional.
interprofessional.
Interprofessional, yeah.
Yeah.
With a minimum of, I think so, 40 or 50 hours during those 5 years at minimum.
Yeah, that's a lot, isn't it?
Yeah,
but good. They're good that there's that support there for them to continue to progress and develop as advanced practitioners. Are you having any challenges with recruitment?
No, not at all. We have long waiting lists. Waiting lists are long, so we could educate another 200 more.
Yeah. I think it's faculty. We're going to lack faculty. That's going to be our biggest challenge.
Yeah, I don't think that's limited to the Netherlands either. I think there are challenges recruiting and retaining staff in higher education as well. So important that people think about the career development. And it may be that we have individuals that want to go into education through use of honorary contracts and various different opportunities to ensure that we have that clinical expertise within the programme as well. So
I don't think the salary is a problem for the educators here. I think we have about the same salary as the practicing nurse practitioners at this moment. And I think that's different in the US. In the US, it is a problem to get educators because they're not paid very well, not that much as a practicing MP.
Yeah, there's similar challenges in the UK with that as well. So we don't want to end on too negative a note. So we'll maybe just move on from here. So thank you so much for your time. It's been great to hear about the Netherlands, and definitely I think we've got so much to learn from each other and to consider for our own programmes as well moving forward.